Welcome back, everyone. This is First Step Center Inside Out, where we talk about how we heal and how we recover, which is from the inside out. Today, we have registered nurse Paige Laidig, who is going to discuss the differences between withdrawals in opiates, benzos, and alcohol. So, let's get started.
When patients come in and they're searching detox from opiates, it is completely different from searching for detox from alcohol or benzos. And the public needs to know that although those opiate addicts are coming in and they are feeling terrible, I mean, they are aching, their joints hurt, their eyes are tearing, their nose is stuffy and running. They have goose flesh skin, they are nauseous, they're anxious. Although they're feeling that, and they score a certain level on the COW, which is a clinical opiate withdrawal system or scoring tool, we have medications to help them. We have medications to help them with the signs and symptoms of withdrawal. We have comfort medications to help all those signs and symptoms of withdrawal that I just discussed. They feel like they're going to die. They come out of their skin. They feel terrible because the opiate receptors just, they bind and they block off in the brain, and they're always in pain. And I understand that. I understand that level of thinking that they're going to die. The problem is that when you have a patient come in that is clearly coming off of alcohol or clearly coming off of benzos, they have the potential to die. They have the potential to have seizure activity. They have the potential to go into DTs. They have the potential to have extremely high blood pressures. They have potentials for all of that. And that's something that the public really needs to understand, that just because, you feel like you're going to die from the opiates, you're not. But there is high potential for you for not staying alive coming off of alcohol or benzos. The one thing that the public doesn't know is that the incidence of deaths with opiates is not the actual withdrawal process. What happens is that we take these patients and we get them clean, and then they leave and they don't follow up with any of the treatment team recommendations, whether that could be a treatment center after an IOP, a PHP, 12-step program, Smart Recovery, Celebrate Recovery, churches, whatever it is that you need for your own recovery. The problem is that they stop doing one of those things, and then they think that it's okay to return back to the drugs or to the opiates, and pills don't work anymore and they're very expensive. And then they go to the heroin, which is less expensive and it's very highly potent. And they end up thinking that they can either smoke the heroin or shoot the heroin at the same rate that they were doing before we detoxed them. And that's where we come in with the opiate deaths, the overdoses that we're seeing all the time. And that's where the opiate epidemic is coming so prevalent, and where the opiate deaths are becoming just, the numbers are just exponential right now. How do you surrender? Mm-hmm. Surrender to win. So something recently, because you keep saying the word scared, that's fear. The opposite of fear is faith. For my own life, I just felt like I had to put my life and my care into the hands of other people around me, other professionals besides myself. Like I said, this has hit me both professionally and personally. I had to walk through the fear. I had to go through the medical detox, and it was not fun. It was 11 days at a medical detox, 24-hour nursing, people watching over me. And then I had to do whatever they wanted me to do and just walk through that fear. And walking through that fear now has put me into my 4th year of recovery and a very well-respected registered nurse as well professionally. But I think walking through the fear is the only way that they get to the other side.
Thank you so much for tuning in today. This has been a First Step Center Productions. If you have a topic that you'd like us to make a video on, please leave it in the comments below. And as always, be blessed stay sober, and thank you.